As women, we experience different changes in our breasts throughout various stages in our life. During puberty, menstrual cycle, pregnancy, breastfeeding, and in menopause. In today's video, we are going to talk about some of the common changes or signs in your breast that you shouldn't ignore. So if you notice any of these changes or signs in your breast, please do well to see your doctor as soon as possible. Hey there and welcome to my channel. I am Dr. Lucy and this is Know Your Health with Dr. Lucy, a space where we share everything related to your health. If this is your first time here, please do well to subscribe so that you do not miss out on what we share here. Now let's talk about the signs or changes you shouldn't ignore on your breasts. First off, let's start with breast lumps. A breast lump is a swelling or localized thickening in your breast that feels different from the surrounding tissue. Take note that our breasts are normally lumpy before or during our periods, and this is just because of hormonal changes during our periods, which is normal. Now the concern comes in when you get a breast lump after your period. This is not normal. So the best time to feel for a breast lump is a few days after your period has ended. Breast lump can feel quite firm or hard, smooth, irregular in shape, and sometimes when you try to move them, they can be mobile or fixed. As I said, not all lumps are harmful, but if you do find a lump in your breast, then it is crucial that you get it checked out. A persistent lump in the armpit or around the collarbone could also be a sign of underlying problem in the breast, so do not ignore that. Another common sign you should not ignore on your breast is nipple discharge. Nipple discharge means that you have fluids coming out of your nipple, and this can be due to various causes, which can be an infection or a cancer. The discharge can come out in a variety of colors, and these various colors can sometimes give a clue of what the underlying cause may be. It could be a clear or watery discharge, which can be linked to hormonal changes or sometimes an early sign of breast cancer. So you need to get that breast checked before it is too late. Yellow or green nipple discharge is often due to infections like mastitis or an abscess. Bloody or red nipple discharge can be due to injury to the breast, infections, or even a cancer, especially if it is from one side of the breast. Sometimes this discharge is spontaneous, meaning you can just take off your bra and then you find there is a discharge, or it can occur when the nipple is squeezed. Please do not ignore all this discharge, especially if it is from one side of the breast only. Get yourself checked as soon as possible. Another sign is dimpling. This is when the skin of your breast looks like an orange peel. In other words, it has multiple dimps. So this happens because of thickening and swelling of the skin of the breast, which eventually extends to the pores and forms tiny dimps on the breast. If you notice this change on your breast, please have a checkup by your doctor. And the fourth sign is the inverted nipple. This is when your nipple points inwards. But this is quite common because some people have had an inverted nipple all of their life. And it's usually nothing to worry about because in some situations it can come back out. But the concerning situation is when you develop an inverted nipple from nowhere. Then in this case you should see your doctor. The fifth one is redness or heat. Feeling of unusual warmth on your breast or part of your breast could be a sign that something is not quite right, because the warmth can be associated with tenderness or redness. It can sometimes feel like an infection. And for breastfeeding mothers, this is quite common because during breastfeeding, bacteria can manage to enter any sores or cracks that you have developed around your nipple. Then the mother starts feeling a lot of warmth on the breast, which later turns reddish and very tender. This is called mastitis, but it is more concerning when you develop a red sore breast when you're not breastfeeding, and in this case you need to get a checkup done as soon as possible. Number 6, flaky rash. A flaky rash around the nipple or the areola of your breast could be a sign of underlying issue with your breast. The rash can sometimes be itchy, scaly, dry, or rough. While sometimes it's harmless, other times it can be a warning sign of something serious. So when this rash is persistent, painful, and spreading to other parts of the breast, then you need to see your doctor immediately. And number 7, change in size of your breasts. Our bodies are normally asymmetrical, and many women have uneven breasts, meaning one side is usually slightly bigger than the other, and this is normal. But the issue comes in when suddenly one breast becomes larger in size than the other. When you notice this change in your breast, then you need to see your doctor immediately. These signs or changes that I've talked about do not always mean that there is something wrong, but sometimes these signs could indicate that you have breast cancer. And if you've noticed any of these signs or changes in your breast, then you need to see your doctor as soon as possible. Well, with all that being said, thank you all for watching. I hope this helps some of the women out there having issues with their breasts. Don't forget to like this video and subscribe to this channel such that you do not miss out on another health related video. Until then, stay healthy and informed.